Arthritis is a common condition that affects many people, and even though there is no cure, there are many treatments available. Joining us today is Dr. Adam Dreisman, orthopedic surgeon at St. Vincent's Medical Center, to tell us all about this. Hi, doctor.
Thank you so much for having me on.
You bet. All right, what are the most common causes and symptoms? And will everybody get arthritis, or can you escape this?
Fortunately, not everyone will get arthritis. Unfortunately, we really have a hard time determining who will exactly. The most common cause of arthritis is what we call idiopathic, where we don't really know where exactly it comes from. Most likely it's just general wear and tear, but the symptoms that we look out for typically are pain that's associated with any sort of weight bearing. So getting up out of a low chair, going up and down stairs. I particularly focus on hip and knee arthritis, and those are the two main things that we look out for.
All right, is there age onset? I mean, in your 50s, 60s, or can it be any time?
You know, tends to be more in the 50s, 60s, and 70s range, but it really can occur at any point. And there's really new treatments out there that we're able to identify this a little bit earlier to try to do more joint preservation in order to try to reduce the risk of arthritis developing to a point that really becomes limited.
When should you see a specialist?
That's a great question. What I tell most of my patients is that I'm happy to see them when they come in when this pain is really debilitating their normal activities of daily living. So if it's limiting the thing, you doing the activities you normally love to do, whether it's playing tennis, going out on long walks, anything that limits pain in the hips and anything from pain in the hips and knees that limits those activities really is when you should come see a doctor to see if there's anything we can do to try to delay the progression of arthritis.
And what are the latest advancements to help you out?
We're very fortunate in orthopedics that we really have a lot of technology that has become involved in our field. Many people have heard about robotics, and robotics has really done a great has really been a great tool to give us more preoperative planning before a surgery. So if a surgery is needed, we're able to do a surgery a lot quicker and more effectively so patients can leave the same day from the hospital after the surgery. There's also new technology coming in down the road. I've been fortunate enough to train with augmented reality glasses. Now, this isn't ready for the prime time yet, but basically you wear these glasses and it shows a digital field in your field of vision. While you're looking at the patient, you can actually see different ligaments and things that you wouldn't normally see with the naked eye. The whole idea is that this technology can allow you to do more minimally invasive surgery so that we can get the patients up and moving a little bit quicker.
Wow, that's going to tell you a lot. All right, we know you have a webinar coming up on October 18th that folks can join you to hear more about this. Thank you, Dr. Dreisman, for your information today.
Thank you for having me on. Thank you for having me on. I look forward to answering any more questions in the webinar next week.
All right, thank you so much.